Now I'm delighted to introduce our speaker, Michael Lake. Michael has been a healthcare technology strategist for over 30 years. I can vouch for that, but he started when he was 12, so he's still a young man. He currently heads up Circle Square, a San Francisco-based strategy, business development, and market research firm focused exclusively on health IT. Michael works with a wide variety of healthcare, life sciences, and technology companies to develop strategies, products, and business models for complex multi-stakeholder healthcare environments. Michael also provides consulting services and publishes industry reports. His Health IT Trend Service combines market intelligence with strategy consulting to help clients understand how to best leverage emerging technologies to impact core business opportunities and issues. At this point, Michael, I'd like to turn the virtual podium over to you.
Hi, Kate. Thanks, everyone, for attending. I'm really excited to share this material with you today. Let's jump into the table of contents, and we'll look at, thanks. So there's 12 topics, starting with global trends, looking at the EMR wars, what's consolidation look like, the difference between utilization and adoption. We're going to look at HIEs, look beyond the EMR, what does that technology look like, physician and patient communications, some ideas about mobile health and remote patient monitoring, clinical analytics, which is increasingly important, and then a couple of topics at the end about hospitals and insurers, and I'll try and bring it all together. So there's 12 topics, and let's plan on spending near an hour, maybe 5 minutes on each. And as Kate said, put some questions in as we go along if something occurs to you. So let's jump into that first one: global trends and U.S. market drivers. Okay, great. So it's important to look at HIT, I think, against this backdrop of longer-term trends in both health and technology. This does a lot to explain both the problem and the solution. The goal is better care at lower cost. The developed societies are getting older, and population lifestyles have led to growing chronic disease that's stretching healthcare systems in the U.S. and elsewhere. We've not yet been able to stop rising costs and provider shortages in many categories of care. Consumers are demanding more. On the technology side, that's one of our hopes. According to Moore's law, the capabilities of technology are doubling every 2 years or so, and that software development particularly is probably doing better than that. So mobile devices, smartphones, tablets, computing in the cloud, these may be arriving just in time to help us. Also, here, consumers are also demanding more. Okay, next slide. So this slide attempts to explain the federal approach. This is the U.S. dynamics. The federal approach in a simple formula, but as we all know, the legislation is far from simple. In my view, it's a brilliant bit of policymaking from a HIT perspective in how the pieces fit together over time to help improve the system. So first is the ARRA HITECH bill. ARRA is American Recovery and Reinvestment Act. It's a stimulus bill, and the HIT sections are referred to as high-tech. This is an acronym I don't really remember. One focus is to increase automation of physician practices in hospitals through incentives for using technology for patient care. It includes setting up organizations that can help, such as information exchanges, mostly about connectivity, and regional extension centers, mostly about meaningful use of technology. So we add to this the Affordable Care Act, which leverages high-tech and targets a new way of delivering care, which is more automated and includes more provider-to-provider collaboration and more patient outreach. One big goal here is to get patients more engaged in their own health. Under this bill, insurers have incentives to use HIT for patient quality, safety, and other medical uses because these items are now considered medical expenses, and insurers want to spend 85% of their money on that and only 15% on administrative issues. This is called the medical loss ratio. The bill is also exploring a variety of alternative forms of care, including accountable care and medical homes. The medical home idea is about establishing a single point of contact with the whole healthcare system, usually a primary care practice that can get access to a patient's records from other providers with patient permission and see the whole picture of care. Accountable care is the idea that hospitals and physician practices align to provide care to a patient with incentives based on quality metrics and outcomes instead of volume. So we have high-tech, automating the providers, Affordable Care Act, increasing physician collaboration, patient engagement. The result is HIT convergence, leading to integrated care management. So here's the shorthand of today's HIT. Providers will use e-prescribing and EMRs combined with new solutions for care communications that include elements like information exchange, mobile, combined with powerful clinical analytics engines to better manage patient populations toward better outcomes. So it's about automating the provider and about provider collaboration. It's about engaging the patient, and it's about clinical analytics helping us deal with populations and outcomes. So that's the drivers in the domestically.